All right, it's 12:03, so we're going to get started. And welcome to everyone who has joined. My name is Jenny Garrison. I'm the Outreach Program Manager for Maryland Health Connection. We've been sharing some wellness tips on screen that hopefully you can keep in mind. You can also check them out on our social media channels at Maryland Connect. We are really excited to be here with you today. It's a busy time of year. We have an election coming up next week. We have a lot going on in the world, and we're losing sunshine. So we are really excited to talk about how you can take care of your mental health and share some key resources with you. As a reminder, we are recording this webinar and we'll share it after it's completed. So let's go ahead and get started. As I mentioned, my name is Jenny. I work with the Maryland Health Benefit Exchange. I'm very excited to introduce you to our speakers today. We have Ms. Patricia Dorn, who is the Health Insurance Administrator from the Maryland Insurance Administration. So I'm going to give you a little overview of Maryland Health Connection and what is covered with all of our plans for behavioral and mental health services. And then Patricia will discuss your rights as a consumer and how you can access the services that you need, and she'll provide some key resources. I'm also pleased to introduce you to Incha Hamdani, who is a board member from the National Alliance on Mental Illness in the Maryland chapter, and she's going to dive into how important it is to take care of your mental health and talk about the resources available to you in Maryland. So let's go ahead and get started. A quick overview of Maryland Health Connection. I think many of you probably are enrolled in our plans, and that's wonderful. We are the official health insurance marketplace in Maryland. You can check us out at marylandhealthconnection.gov. We also love to recommend our mobile app, Enroll MHC, which makes uploading your documents really easy because you can take a pic with your phone. As a reminder, this is the only place where you can get financial help for your health plan. We are seeing folks save an average of $388 a month on their premium. And we know that Maryland is such an awesome state to live in because we are fortunate to have the third lowest health insurance rates in the nation. And you know that we're coming up on an open enrollment on November 1st. Here's some ideas of some costs that you might see. We have an extra cost savings program for young adults ages 18 to 37 that has significantly reduced costs for young adults and brought even more young adults into the marketplace, which helps to keep the rates low for all of us. So if you have a young adult in your life, definitely share this information with them to let them know that a health plan is actually affordable for them. And also we have the key health insurance carriers in our marketplace. Aetna, CareFirst, Kaiser, United Healthcare, and WellPoint has been added into the marketplace this year as well. As I mentioned, open enrollment starts on Friday, November 1st, and runs through January 15th. So if you're enrolled through us, it's now you can take a look and switch your plan. Make sure that you continue your coverage. And don't forget, we have help to help you understand all of your options. If you enroll in November or December, your plan will start on January 1st. If you enroll in January, your plan will start on February 1st. So we are always excited for open enrollment season. I hope you are too. I want to cover the essential core benefits that are included in all of the Maryland Health Connection plans to make you aware. Every plan includes free preventive services. Preventive services are before you get sick, like your annual wellness checkups, different vaccines and screenings are covered. And we know that regular checkups or screenings can help find problems before they get worse. And then research shows that regular visits will help you live a longer and healthier life. So a couple preventive services that are available, just to give you an idea for free, are screenings for things like depression, domestic violence, blood pressure, cholesterol, diabetes, obesity, and more. Vaccines are also covered for free for children from birth to age 18 years old. I have two small ones of my own, so I know how essential it is to have the coverage for your children. And also our annual Well Woman visits are covered for free, including birth control for women at no cost. Well baby and well child visits are also free. Check out marylandhealthconnection.gov to get the full list of preventive services that are available for adults and women and children. Including free preventive care, all Maryland Health Connection plans provide the same core benefits. We call them the essential health benefits. That includes your mental health care. It is covered. Doctor's visits are covered. Hospitalizations, substance use disorder treatment is also covered. Pediatric care, including dental and vision benefits, prescription drugs, lab tests, preventive care, maternity and newborn care, and more. Again, all of the benefits are listed on our website. So if you're curious and you want to take a look, definitely visit marylandhealthconnection.gov. I also wanted to mention value plans because we're coming up on open enrollment. You can always take a look at our value plans, which are designed to offer lower deductibles and useful coverage for more services before you meet your deductible. And they're also designed to lower your out-of-pocket costs. To give you an example, there's a value plan for people who need diabetes treatment, and that includes more of the supplies and the medications that you need to cover your diabetes needs. And so you could take a look at our value plans. Again, this is also listed on our website. And let's talk a little bit more about the behavioral and mental health coverage that's included as well. So as I mentioned, behavioral and mental health services are covered by all of our plans as an essential core benefit. It's very important to know that you can't be denied coverage or charged more because you have a pre-existing condition, and that includes a mental and behavioral health condition. So what is covered then? Behavioral health treatment, including counseling and psychotherapy, inpatient services for mental and behavioral health needs, rehabilitative and habilitative services as well, prescription drugs, and emergency services. So these are really essential benefits that are included in all of Maryland Health Connection plans. And as I mentioned, Patty's going to talk you through your rights as a consumer. Sometimes it can be hard to access the care that you need for mental and behavioral health services. And the Maryland Insurance Administration can really support you with that. And she'll talk about that in just a few minutes. And also we encourage you to take a look at our plans and prices at marylandhealthconnection.gov. Your specific behavioral health benefits will depend on the health plan that you choose. So now's a great time with open enrollment to make sure that the needs that you have for your health and well-being are going to be included in the plans that you select. Each plan provides a plan cost and benefits guide, as well as a prescription drug search. So if you know that you have specific needs as you're looking at your plan, you might want to take a look at the fine print, as they say, and look at the plan cost and benefit guide to make sure that what you need is going to also align with the plan that you select. And a few other tips to keep in mind. Some type of inpatient admissions may need pre-approval by your insurance company before you receive services. So please keep that in mind. Your physician or psychologist can help you with the pre-approval by completing the paperwork and submitting it to your insurance company. For an emergency inpatient admission for treatment of a mental illness or emotional health disorder, your insurance company must make a decision on whether to pre-authorize the inpatient treatment within 2 hours of receiving the request. So as I mentioned, Patty will talk about some extra rights that you have in a situation like this in a few minutes, but these are some key tips to keep in mind. And lastly, our plans also offer telehealth services. They do vary by plan and insurance company, but the telehealth services often include primary care and OBGYN care, urgent care, behavioral health, and some medical specialists will also do telehealth services. And here's a few key resources that we'll share the slides with you, and the recording of the presentation will also live on YouTube, so you can access these links. But if you or someone you know does need mental or behavioral health support, there are a lot of resources in Maryland and across the country that can help. I see the 988 number as well. And I love that there's a crisis text line, because we know that most people are on their phones. And so I think that is really awesome. And NAMI Maryland, who will be speaking in a few minutes as well, on their website, they also list crisis hotlines from each county in Maryland. So I think that that is a really awesome resource as well. And at marylandhealthconnection.gov, we are happy to help you understand your plans and make a decision on the best plan for you. We have many ways that we offer support. We have a virtual chat on our website. We work with insurance brokers across the state who are certified through Maryland Health Connection. You can fill out a form on our website and a broker will call you in 30 minutes or less. You can pick one that's close to your home, so you could even meet with them in person. That service is free for you. We also have a consumer assistance program across the state. We have over 100 healthcare navigators that provide free in-person phone or phone help to get you enrolled in a health plan. And of course, you can always call our call center as well. This is my email, jenny.garrison@maryland.gov. Please feel free to reach out to me if you need support. If you're looking for resources, I'm happy to help. And I know we have some questions coming in, so we'll try to answer them as we move through, and we'll try to leave some time at the end for chat as well. And now I'm excited to turn it over to Miss Patty Dorn to talk about the Maryland Insurance Administration support. Thanks, Patty.
Thanks, Jenny. Hi, my name is Patricia Dorn, or Patty. I'm with the Maryland Insurance Administration, and I'm going to talk to you today about mental health benefits and a new program that we have at the Maryland Insurance Administration, the Health Coverage Assistance Team. So I'm going to cover the Mental Health Parity and Addiction Equity Act today, also known as MAPIA. We're going to talk about steps to take when your health plan does not have an appropriate provider or a doctor for you within your plan's provider network. And I'll introduce our health coverage assistance team at the end, and I will talk a little bit about this new program. Next slide, Jenny. All right, so MAPIA, the Mental Health Parity and Addiction Equity Act of 2008. So health insurance is coverage for physical health, mental health, and substance use disorders that are paid for by health plans, health insurance or health plans. The Mental Health Parity and Addiction Equity Act, MAPIA, or also known as Parity, it requires most health plans to apply similar rules to mental health and substance use disorder benefits as they do to the medical and surgical benefits. So mental health equals physical health. And I just want to say that most of this, MAPIA is a federal law, and this information comes directly from the Department of Labor, cited at the bottom. Next slide, please. We're going to show a little video. What is mental health and substance use disorder parity?
It's true. What you don't know can hurt you, especially if you struggle with getting care for mental health or substance use disorder. For example, John and Jim work for the same company. John has diabetes and gets the care he needs. Jim has a substance use disorder, but has a difficult time getting help. Stricter authorizations, limitations to treatment programs, unexpected charges. Know this: federal law requires mental health and substance use disorder parity. If your job-based health plan offers coverage for mental health or substance use disorder, the law says it must be covered without additional restrictions or higher costs. Now that's parity.
that video talks about physical health equals mental health. By federal law, the plans are supposed to treat your mental health conditions equal to physical health. And maybe somebody can put the link in the chat. It is a great video. So most health plans are required by law to offer this parity for mental health and substance use disorder benefits. Generally, these plans include most employer-sponsored group health plans and individual health insurance coverage, including coverage sold on the Maryland Health Connection. So this is really important. About 20% of Marylanders do get their insurance from the Maryland Health Connection, but over half of Marylanders get their insurance through an employer, through a self-funded plan through their employer. And they also have to follow MAPIA. So it's really important to understand that most health plans that Marylanders get their health insurance through do have to follow this federal law, MAPIA. Physical health equals mental health. Next slide, please. So what it means for you, it means that financial requirements such as co-payments and treatment limits, so what you're paying out of pocket or how many times you can visit the doctor, they have to be comparable for physical health as mental health and substance use disorder services. Parity also applies to rules related to how mental health substance use disorder treatment is accessed and under what conditions the treatment is covered, such as whether you need permission from your health plan before starting treatment. In other words, similar rules with regards to what you might think of as pre-authorization or prior authorization. So the plans must apply comparable copays, physical health, mental health, comparable copays for MHSUD services and physical health services. There can be no limit on the number of visits for outpatient MHSUD treatment if there is no visit limit for outpatient physical healthcare treatment. And then again, pre-authorization requirements for MHSUD services must be comparable or less restrictive than those for physical health services. Next slide. So that is MAPIA. I do recommend you can check out the Department of Labor's information on MAPIA. I do recommend that video as well. And I'm going to pivot now to Maryland state law. And so this is a, has this ever happened to you or someone you know? So a person, say, needs to see a therapist with a particular type of expertise, but the mental health providers that are listed in the plans are maybe not accepting new patients, or possibly the first available appointment for this therapist with this particular type of expertise is months away. Maybe the person's healthcare plan suggests going to see a different type of therapist, but you as a patient know that you need this particular kind of therapist. But again, not accepting new patients, or maybe their first available appointment is many months away. So what should you do to get the right care and have your health plan cover the costs? And what are your options at this point? So I'm going to talk a little bit about out-of-network benefits and Maryland law. Next slide. So your health plan's network is made up of in-network providers. Those in the network are in-network providers. And when you use in-network providers, in general, you only pay your deductible and any of the applicable co-pays or co-insurance as listed in your plan. An out-of-network provider is any healthcare provider who does not have that contract with your insurance company or your insurance plan. So in some situations, Maryland law protects you when you can't find an in-network provider who meets your needs. Your health plan must approve treatment from an out-of-network provider at in-network out-of-pocket costs in Maryland if you're diagnosed with a condition or disease that requires specialized healthcare services or medical care. And there's no in-network provider with the professional training and expertise to treat or provide healthcare services for that condition or that disease, or your insurance company cannot provide reasonable access to an in-network provider, say in the situation where it's unreasonable delay or it's unreasonable travel. So in those situations, your health plan must approve treatment from an out-of-network provider at in-network out-of-pocket costs. Next slide. In these situations, so this is for everything. This is for physical care, and this would be for mental health and substance use disorder. So for absolutely everything, this first law applies. In these situations, you will pay the in-network out-of-pocket expenses, and you might also receive a bill from the out-of-network provider. So this is really important. If it's a physical health condition, the provider can balance bill you. So this is the example. You have a contract with your insurance company, has a contract with providers that are in your network. And let's say, and let's say it's $100 for a visit. Now you want to see an out-of-network provider, and maybe that out-of-network provider charges $200. If it's a physical health condition, so you're seeing an out-of-network doctor, you paid your regular copay, they could still balance bill you for that difference between the $100 and $200. So the Maryland law applies to physical health and mental health, but in the physical health case, you could be subjected to balance billing. So balance billing is when that out-of-network provider charges you the difference between what your insurance pays for that service and what they charge for the service. Next slide. So I go into a little bit more balance billing here. And I hope that that was clear. Next slide. But with mental health and substance use disorder, you cannot be balance billed. If your insurance company says, yeah, it looks like you need to see an out-of-network provider, and it looks like we either don't have someone to treat your condition, the wait is too long, the distance is too far for you to travel. Not only do you pay your regular in-network out-of-pocket costs, but there can be no balance bill. So if you're approved by the insurance company or the insurance plan to see an out-of-network specialist for mental health or substance use disorder, your health plan must pay the costs of the out-of-network specialist service, and there will be no balance bill. Again, just so you know, just so it's in your mind, for physical health, it is different. You would pay those in-network charges, but you would still potentially have a balance bill, which is something that you should discuss with any out-of-network provider. Next slide. So for mental health and substance use disorder services, your health plan must ensure that the improved out-of-network services cost you no more than you would have paid if you received the services from an in-network provider, from someone in their network, someone that they have a contract with. No balance bill. You are still responsible for the in-network cost-sharing amounts, deductible, copay, coinsurance. To get approved to see an out-of-network provider, and it is important to get pre-approval, call the number on the back of your health insurance card. It's possible in many situations, there's a separate number listed for mental health and substance use disorder services. Next slide. So the plan has to decide in a timely manner. Usually that is no more than 2 working days after the plan receives the information necessary to decide. So you need to give them the information that they need to make a decision. There is slight variation from plan to plan, but in general, it is 2 working days. If a patient is in immediate danger, imminent danger to self or others, as has been determined by the physician or the psychologist and a member of medical staff who has admitting privileges, then the insurance company cannot deny the first 24 hours of admission based on medical necessity. So the first 24 hours has to be considered in network. It's very important to make sure that the insurance plan is notified as quickly as possible. For an emergency inpatient admission for treatment of mental illness, emotional health disorder, or substance use disorder, the insurance company must make a decision on whether to pre-authorize the treatment within 2 hours of receiving the requested documents. They have 2 hours. Each insurance company does have specific instructions. In general, they are going to give you all that information when you call that number on the back of the card. However, we also post updated information for each insurance company on the Maryland Insurance Administration website. That is posted here. You can always reference that, if you think there's a conflict with what you're being told on the phone, or if you're just more comfortable looking at that information online before making that call. It's important that you follow the directions for your specific insurer. They do vary slightly from insurance company to insurance company. But again, it likely starts with calling the number on the back of your insurance card to discuss the situation with a representative. Next slide. Oh, and it's specifically, that is to start your attempt to see an out-of-network provider, as well as file a grievance if your request to see an out-of-network provider has been denied. So if your request to see the out-of-network provider is denied, the insurance company denies your request, you can call us, call the Maryland Insurance Administration for help. If it's an emergency and care has not yet been rendered, the Maryland Insurance Administration is available via our 24/7 hotline. So it's 1-800-492-6116. We are available 24/7 for medical necessity emergencies. We make a decision within 24 hours. And then it says for all other situations, you're going to contact the MIA's Health Coverage Assistance Team. That's the HCAT team for help. And I'm going to go into a little bit more about that in a minute. So this is an introduction to a new team that we have at the Maryland Insurance Administration. I myself am the health insurance administrator for the HCAT team. We are available to provide one-on-one help to individuals and their loved ones or advocates for any health coverage related question or concern. It's important to know that organizations in Maryland that help consumers can use HCAT too. The HCAT program, however, is not for providers. So the HCAT program lives within our consumer education and advocacy unit, and the broader unit itself provides webinars, we attend events, one-on-one assistance, etc.
Yes.
Next slide. So our services, the HCAT team, we help individuals regardless of the type of health insurance or coverage. That's important. We will help you if you have an individual plan that's regulated by the Maryland Insurance Administration. That might seem a little bit confusing, but if you buy a plan from the Maryland Health Connection, if you have a family plan, etc., that falls under our jurisdiction. Those are plans that we regulate. We can help you. Employer-based plans regulated by MIA. Some of the plans that you get from your employer do fall under the jurisdiction of the Maryland Insurance Administration, which means that they are insurance that's offered by an insurance company. A very high percentage of plans that you get through your employer are considered self-funded. And what that means is that your employer essentially owns that pool of money that pays those claims. And this program, although although your plans don't fall under the jurisdiction of the Maryland Insurance Administration because it's not an insurance company, on your card, you might have an insurance company's name, but they are essentially a third-party administrator doing the paperwork. The HCAT team will help with these employer-sponsored plans. So if you get your insurance from your employer, you are guaranteed you can contact HCAT for assistance. We help with the Medicare supplement. We can help you with Medicare Parts A and B and Medicare Advantage. For the most part, you're talking to us and we're getting you to the SHIP program in those situations. Medicaid questions, again, many times with Medicaid, we are working as a navigational service just to make sure that you land in the right place and get those questions answered. Veterans, TRICARE, VA, TRICARE, self-insured, those are the policies that you get from work. Some of them fall under the Department of the federal law ERISA, some do not. It's not important necessarily for you as a consumer to know that distinction. Just know that ERISA and non-ERISA, you can reach out to HCAT and we can help you with your questions, as well as contracts issued and delivered to the policyholder in another state, which that means you get your insurance from an employer in Virginia or something along those lines. And then it's really important that the HCAT team can help and does want to help those who are uninsured and those who are underinsured, or even people who are not sure what their insurance type is. So essentially, we are going to be assisting with all kinds of, the program started in June. So we are assisting with questions about all kinds of health insurance in Maryland. Next slide, Jenny, thanks. So we're going to work with individuals, their loved ones, or their advocates. We can answer questions about your health insurance. We can talk to you about how to get health insurance if you don't have it, and how to use it if you do. We offer materials helping you understand health insurance, and also we attempt to understand your specific concern and then suggest next steps to address it. We will hold your hand as well. If you need us to call an entity with you, we will do that. In a lot of cases, we're getting you to the right person. You might come to us with a Medicaid question, so we're going to need to get you to the Department of Health, but we're not going to necessarily let you go there. We're going to check up on, unless you tell us not to. We're going to make sure you got your question answered and you can circle back to us if you still have concerns, if you have more questions, or if you need to navigate to another place. We're trying to answer the questions that we can, and with the questions that we can't, we are trying to work as a navigational system to hold your hand and make sure that your health insurance concerns and your questions get answered. If you do need to file a complaint with the Maryland Insurance Administration, we're going to help you understand how to file a complaint with us or a grievance. And again, we will stay with you, or we will follow up with you when necessary. Thanks, Jenny. So just some examples of coverage issues that can affect you, the consumer's access to health care. Something like, I can't find a provider who's accepting patients or has an open appointment, or the provider that my health plan recommends doesn't meet my needs. My health plan states that the services I need are not considered medically necessary, or I don't think my benefits cover the mental health or substance use services I need. Those are just examples of times when you can reach out to the HCAT program. Next slide. So we're going to provide one-on-one help for any health coverage related question or concern. Please contact us on behalf of any individual or loved one to get information or help with a coverage related issue, or obviously reach out to us on behalf of yourself. And again, we will work with partner agencies and organizations across Maryland. That's our phone number, 410-468-2442. You can reach us at hcat.mia@maryland.gov. That is it. And I'm going to pass it off to Insha with Nami for the rest of the presentation.
Thank you, Patty. That was brilliant. A lot of information. I I was taking notes, and even though I know that there's a recording available, but yes, thank you for sharing all these resources. I'm sure everybody who's joined us today is appreciating that. And yeah, with that, just want to thank everyone for being here. I am going to be talking about NAMI, which is an acronym for the National Alliance on Mental Illness. It's the country's largest grassroots mental health organization dedicated to building better lives for the millions of us Americans affected by mental illness. NAMI speaks for those unable to speak for themselves until they are ready to speak for themselves. That's the important part. Our core values are belief and hope, the possibility of recovery, wellness, and the potential in each one of us. We embrace diverse backgrounds, cultures, and perspectives, so we are inclusive. We promote confidence, self-efficacy, and service to our mission, equipping, empowering individuals and families through the resources that we provide. And we are compassionate, which we show through our respect, kindness, and empathy. And finally, we fight for equity and justice as one of our absolute core values. Jenny, next slide, please. So NAMI Maryland is the official NAMI state organization in Maryland. And NAMI Maryland also seeks to improve the quality of life for individuals with mental illnesses and their families and their caregivers. We are dedicated also to providing free education, support, and legislative advocacy for persons with mental illnesses, their families, and the wider community. NAMI Maryland also trains many of those who have received NAMI support and education to deliver the same programs and to reach and educate the community in specific audiences. So it's like a web, it's like a network where each one benefits from NAMI services and then in turns take those services further to others. The NAMI office staff is small, but it has a wide reach, and we are working with hundreds of volunteers, more than 55,000 individuals and organizations from a wide variety of socioeconomic, racial, ethnic, and professional communities who share and believe in our interest and in our mission. NAMI Maryland supports 11 local affiliates across Maryland, ranging from some who have offices and some who just have a very small staff. All to say that what is important for us is our outreach. Next slide. I just want to take a minute to introduce myself. And I didn't begin with that because I wanted to first share what NAMI and what NAMI Maryland really represents and the organization and their ethos. So I am a mother of a child who was diagnosed with mental illness. I am now also privileged to serve as a board member on the NAMI Maryland board. My focus and my effort is advocacy efforts that NAMI Maryland is undertaking, and so to contribute to that however I can. I also work with others to help break our isolation as caregivers and people who have loved ones who are suffering with a mental illness. And the effort is to take support closer to whoever needs it, to remove the stigma. And I do that as a family support group facilitator. And another part of what I do is through Johns Hopkins, is that I am a program manager for public health programs that we implement in low and middle income countries. And one of the taglines for our programs is that where one lives should not determine if one lives. And this makes sense in the context of communities and countries that do not have the resources. So yes, thank you. Next slide. So today, because we have limited time, just wanted to quickly focus on the advocacy work that NAMI Maryland has undertaken. And in 2024, which is still ongoing, we have passed 6 out of 8 priority legislation bills. And I want to quickly just go through what these bills are. So the Assisted Outpatient Treatment Program, which is AOT, establishes assisted outpatient treatment programs across the state of Maryland. A petition can be made by either the director of a mental health program receiving state funding or by an individual at least 18 years old who has legitimate interest in the welfare of the respondent. This bill is headed to the governor's desk for his signature. The other bill, the second bill, the Utilization Review Bill, is going to revise utilization review criteria and will help reduce the volume of prior authorization requests. As amended, it prohibits insurers from denying a request for a medication renewal for mental health conditions if the insurer has already approved the drug and the patient has been successful. This bill also is headed to the governor's desk for his signatures. The 988 funding bill will establish a permanent funding mechanism for the services. And I don't know how many of you have used this. I have personally used the 988 helpline, and it is incredible in how they have services, resources. And what I particularly appreciated was how they will also share what is their limitation, what they can do, and what they cannot do. But sometimes it's very important to know, just as important to know what they can do. So this bill, also headed to the governor's desk for his signatures, will guarantee funding. The other bill is the caregiver tax credit. And once amended, this bill establishes the Caregiver Expense Grant Program in the Department of Aging to award up to $2,500 to certain caregivers. Again, awaiting governor's signatures. The other one on our list is the Landlord-Tenant Liability to Pay Rent Bill, which limits a tenant's liability to pay rent for no more than 2 months should the tenant need to vacate the leased premises due to a mental disorder if the continued residency at the place is unfeasible or requires the patient to move to a home, to a facility, to an institution for purposes of higher level of care. Again, awaiting governor's signatures. The Reentry Services Bill will create a program within the Division of Correction that would provide formerly incarcerated individuals and individuals on probation with certain services that will include assistance obtaining vital documents, information regarding housing, assistance in obtaining transportation, mental health services, and substance abuse counseling and prevention services, among many other wraparound services. Unfortunately, this bill did not receive a vote in the committee in either chamber. However, a task force has been established on the creation of a division of returning citizens and expanded reentry services. This task force will develop a plan to expand the services for individuals in the state after release from incarceration. So this is work that is still ongoing. Jenny, next slide, please. This bill, we have committed an entire slide to this bill, which is Fail First, but it is also called the STEP therapy. The reason why we're focusing on this is because if this bill is passed, it would prohibit private insurers and Medicaid from applying STEP therapy, which is also known as Fail First protocols, for drugs that treat certain mental illnesses including bipolar disorder, schizophrenia, major depression, post-traumatic stress disorder, or a medication-induced movement disorder associated with the treatment of serious mental illnesses. So in layman terms, what the fail first or the step therapy protocol really means is that health insurance companies stipulate that patients must first try one of the more lower cost medication before they can access their doctor's recommended prescription in case it costs more. The reason why insurers do this is to obviously reduce their costs. But I would be remiss if I did not mention that sometimes in some specific cases, this protocol can help make medications more accessible in all communities in case there's a shortage or accessibility issue. But what we are working on and focusing on is that no insurer stipulates that a patient and especially if the doctor has recommended a particular drug, it cannot deny it to the patient if we know that it is going to be more effective, because this potential delay in effective treatment, waiting for the low-cost drug to fail first, will limit a patient's ability to get the medication they need, and we cannot put cost cutting before clinical evidence. So this is an ongoing effort. We are keeping our eyes on this. We are going to move as required to make sure that we get some attention and we can pass this bill. Thank you. Next slide, Jenny, please. So for NAMI Maryland, there are two important dates that I want to share with all of you. One is our annual Advocacy Day, which will fall in February during the 2025 legislative session. And that is when we will be, NAMI Maryland will be taking our advocacy efforts to this forum. But I also want to bring your attention to the Smarts for Advocacy class that NAMI Maryland holds for people like me and you and everyone who may be interested. If you visit the NAMI Maryland website, you will see that there is a really interesting invitation to the NAMI Smarts program, and I can quickly read some of that out to you, which it says, never thought of yourself as an advocate. If you want to make a positive change in mental health services, grassroots advocacy is the answer, and it is simple. We don't have to know in great detail about policies or even politics. What this NAMI Smarts program will help us strengthen is how to use our voice to influence policymakers and to make a difference. So we can turn our passion and our lived experience into a positive voice for mental health with the NAMI Smarts for Advocacy grassroots advocacy training. I have two email addresses here. If you can note them, we can also put it in the chat. Please do write on these email addresses for more information on how you can partake in the advocacy efforts. Next slide. So this slide and the next one, I am not going to go into great detail. This is really just to share a snapshot of the wealth of information and data and all evidence-based resources that you can find on the marylandmd.org website or on the the NAMI national website. They do this, I mean, what you see on your screen and on the next slide, this is a snapshot of our data briefs. This does fit into one screen, but I just want to quickly take a moment and appreciate all the effort that goes into gathering this data and sharing it in a snapshot with anybody who's interested and can use this information in their advocacy. Thank you. Can we move to the next slide, please? So I'm going to take about a minute or two to talk about the programs that and the resources that we offer, all free of cost, to people who need them and who are interested. So NAMI Maryland develops and provides these free resources, from fact sheets to webinar, and posts them on our website, of course, that you can find. But then there are also some interactive programs that we have, which are all listed to the right-hand side. So the first one is a family support group. We meet in person, and we also have online sessions. And if you go to the NAMI Maryland website, you'll be able to see the schedule there. It's a structured problem-solving support group for family and close friends who have a loved one who is suffering from a mental illness. It is facilitated by intensively trained family members who have been there. I would really encourage and invite everyone to check it out. It has been extremely useful for me, and so I would love for people to also benefit from this service and this resource. The other is the NAMI Connection Recovery Support Group. Again, it's a structured problem-solving support group for individuals with the mental illness. Again, facilitated by intensively trained peers. The third program is the NAMI Smarts that I just talked about. I want to move to the NAMI Family to Family program. This is a free 8-session education and skills course for families. I have attended it myself. It is absolutely fabulous, extremely helpful. Trained by trained relatives and family members. So like I said earlier, NAMI is where we all first receive these resources, the help, the support, we train ourselves and take them further. So this is it's the same approach. The next one is the NAMI in Our Own Voice. It is a very powerful program whereby we work with people living with a mental illness, and these people, we work with them and train them to tell their stories in their own voice. And the power of listening to these testimonials, to these stories, is unmatched by any other data sheet. So hats off to the people who join this and are willing to share their stories with others, so that it breaks the isolation and can serve as education for the community. The other program that is not on your screen is a Family Basics 6-session education and skills course for caregivers of children with mental health issues. So this focuses on caregivers of children. And we also have a NAMI Homefront, which is again a 6-session education course for family members. So once you go onto the NAMI Maryland website, you'll be able to see all these resources. But I wanted to take some time to just share some of these with you today. Can we move to the next slide, please? Just to kind of wrap up on what NAMI does, we wanted to share NAMI's approach. And they're listed here, but I want to read them out because they're really important. So the key components of NAMI's approach in all its programs is mental illness has a biological basis, and it's not anyone's fault. Mental illness has the trauma basis of the lived experience of mental illness. The most effective treatments address bio, psycho, social elements, not one or two, will have the same impact unless we bring all three elements together. And the gold standard of care is collaborative in nature. No one individual, no one family alone can help. Can we go to the next slide, please? So what has made NAMI start from one family sitting around a table talking about this need to where it is today, one of the largest grassroots national organization? So the core strengths of how NAMI has been able to be effective in meeting some of its objectives and goals, and to invite and include so many people, is the power of personal experience, the personal narrative that can change audiences to change minds. Like I said, I joined NAMI because of my need for information, and now if I am a facilitator, I'm coming to my group with my personal experience also. The other core strength is the belief that and the understanding and the acknowledgement that a mental illness can happen in anyone's family or directly to you, and that is traumatic. So what NAMI does is it helps transform that trauma into positive action and change. Everyone is affected somehow with mental illness. And so to think that it is them versus us, that is something that we try to kind of bridge and have everybody understand that we are all affected. The power of groups of people coming together in engaging the community, in engaging with an individual is powerful. And the next level of the same small groups coming together and forming partnerships is really the magic and how things happen and how we can all find a place to connect and to meet other people. And at the end, I just want to invite all of you and to share with your family and friends to join NAMI. Join us to share your story, join us to advocate, join us to help our community. Thank you so much.
Thank you, Incha, and thank you, Patty, for all that incredible information. I just want to, I know we're at time, so I understand if folks have to hop off, but I want to make sure that we've addressed most of the questions. I know that our colleagues have been responding in real time. But let's go through and make sure that we've answered everything. And as a reminder, we are going to send a recording of this by email to those who registered, as well as add it into our YouTube channel. Here's a question. I see if language access is needed, is that covered as well? Yes. Maryland Health Connection offers service in over 200 languages. And I know that the Maryland Insurance Administration also works with interpreter services as well. What is considered reasonable if out-of-network providers are specialized in terms of language access and cultural expertise? Is that an option for a client to get approval? Might be a question for Patty.
I believe so. So that is not defined in the law, but you can certainly request on those on that basis. The other thing that I think was in there was what is, I don't know if that was for me. It's reasonable distance, reasonable time. That is undefined in the law. And so you need to ask based on your own interpretation of what is reasonable. And if you are denied, you can appeal with the Maryland Insurance Administration.
Okay. Which plans provide out-of-network coverage for social worker or psychologist visit? What do you think, Patty? I think that that's something you would want to evaluate each plan individually for, to see what is covered in your plan for out-of-network services. It does depend on which type of plan you select. You think, Patty?
Right, yeah. Yeah, your navigator could assist you with the finer details of that as well, if you're
Okay.
talking about a Maryland Health Connection plan.
Great. Let's see. I'm just looking to see all the questions. Can Medicaid health plan provide behavioral or mental health coverage after negotiations? Currently, it seems as one has to go out of the health plan to find people who accept Medicaid for behavioral and mental health. Mental and behavioral health coverage is included in Medicaid. So you shouldn't have to go out of that plan, but I think if you're having network adequacy issues, or if your services are being denied, that's something the Maryland Insurance Administration could support with. Prior authorizations have become an increased barrier to receiving healthcare. Do you have any tips, Patty, on overcoming hurdles of prior authorization?
We have been working on a tips guideline with the National Association of Insurance Commissioners, which we should be publishing on our website shortly. I would just make make sure that if anything is asked from you, that you provide it as quickly as possible, and you speak to your doctor about doing the prior authorization. But yeah, we will be posting a tips for prior authorization on our website soon, but it's not available quite yet.
Okay, so check into the Maryland Insurance Administration for more information on tips for prior authorization issues soon.
Yes.
That's great. How may I contact an advocate? My son's condition started at age 30 and I want to help him not to isolate. Then NAMI shared a few resources. I think we'll respond to you with the link for reaching out to NAMI for that question.
Yes, absolutely. If we can go to the NAMI resources, there's definitely the family to family support group where there's lots of information and resources shared. So.
All right, I just added info@namimaryland.org in response to that question. So you could reach out directly to NAMI at that email and they'll get back to you. Thanks, Incha. Let's see, that question was answered. How are we doing here? Yes, there will be a recording sent to you, and it will also be posted on YouTube. All plans cover behavioral health, so check out your plan for more information. The issue I've always had is finding a provider that takes MedStar Family Choice that isn't far and is taking new clients. It's been about 2 years. I think that is something that the Maryland Insurance Administration might be able to help you with, depending, Candace. So if you want to reach out to us, I think we could try to support you with that. Patty,
Yeah, and I also, oh, sorry, didn't mean to speak over you, Jenny, but I also put down the 988 number. Just looking at some comments in the chat, even if it's not a quote unquote crisis, we can still call them because they have resources and they have information. In fact, there may also be somebody who would be talking to your loved one who's been recently diagnosed or upset. So yes, please do call. I want to say that in some situations 988 is way better than 911. So instead of calling 911, 988 is trained for mental health concerns that we may have. Thank you.
Thank you. I see a question. I'm 66 years old. Can I receive services? And the answer to that is yes. These services are available to you at any age. Can you have a telehealth appointment with a provider located in another state? That's a good question. Any thoughts, Patty? Can you have a telehealth appointment with a provider in another state?
Yeah, there's a really good chance that that could certainly count as out of network and could certainly be processed as an in-network. Again, use the process with your insurance company, but I don't think the fact that it is out of state is necessarily going to get in your way.
Okay. And what's needed to be signed up? And I see that Amy has added our application checklist, which talks to you about the documents that you would need to sign up. Overall, you would want to bring your income information, your social security number, your ITIN. And there's a full list available on our website. What service is available for patients who decline mental health treatment, but family clearly sees serious issues at home? That's a really good question. That sounds like a difficult situation. I think I see that INCHA has added 988, and I think I would also encourage you to reach out to NAMI for more support there for your family member. Sometimes I think we want to do more than the other person wants, so that is a difficult situation.
Yeah, and I just wanted to quickly chime in to say that yes, anxiety is a form of mental health for sure, and 988 can certainly help. Just talking to someone who's trained can make a great difference. Thank you.
All right. Okay, and I see that we're now about 10 minutes past time. I think we've answered almost every question. I'm going to add my email in chat if someone has a question that we were not able to answer or you are looking for more resources. Please email me if we can do something to support your community to get health insurance. Please reach out to me as well. I'm happy to provide a resource or a link to help support you. And I want to take a moment to thank Patty and INCHA for their very in-depth presentations that we provided. And thanks to all the Maryland Health Connection team on the call for your support with this webinar as well. And I wish you all a very wonderful day. Thank you very much.